Hello, and welcome to Dr. Ties. In this video, I will be talking about what sickle cell disease is, its common symptoms, and how it can be managed. Sickle cell disease refers to a group of inherited or genetic conditions that affect the oxygen-carrying red blood cells in the body. The most serious type of these conditions is called sickle cell anemia. Sickle cell disease is more common in people with an African, Caribbean, Middle Eastern or South Asian family background. People with sickle cell disease produce abnormal crescent or sickle-shaped red blood cells. This is the reason that this condition is called sickle cell disease. These abnormally shaped red blood cells do not live as long as healthy blood cells. They can get stuck in small blood vessels in various parts of the body and block blood flow, leading to pain or sickle cell crisis. Sickle cell disease is a genetic condition, and it is caused by a fault in a gene that affects how red blood cells develop. It is passed on in an autosomal recessive way, which means that a copy of the faulty gene from both parents is needed to cause sickle cell disease. People with one faulty gene can be carriers but would not have sickle cell disease themselves. This is known as having the sickle cell trait. Sickle cell disease is a lifelong condition, and it can be mild or cause serious symptoms in some people. Mild sickle cell disease may not cause any major symptoms or have a significant impact on a person's daily life. Since this is a genetic condition, it can present with problems from early childhood. However, some children may not have severe or frequent symptoms, and they can lead normal lives most of the time. The common symptoms of sickle cell disease are anemia leading to fatigue, tiredness and shortness of breath, painful episodes or sickle cell crises that can be severe and last for days or weeks, and increased risk of infections. There are rarer problems that can occur with sickle cell disease, and these include lung disease, stroke and delayed growth. Sickle cell disease can be detected through screening during pregnancy or soon after birth. It is also possible to have blood tests at any age to check for sickle cell disease and the faulty gene causing it. Sickle cell disease is a chronic condition and people would need treatment throughout their lives. It is recommended to drink plenty of fluids and stay warm to prevent painful episodes or sickle cell crises. Painkillers such as paracetamol can be considered for these painful episodes. Some people with sickle cell disease may require daily antibiotics and regular vaccinations to reduce the risk of infections. A medication called hydroxycarbamide or hydroxyurea and regular blood transfusions are among other treatments available. An emergency blood transfusion is usually performed for severe anemia. The only cure for sickle cell disease is a stem cell or bone marrow transplant, or gene therapy to fix the faulty gene involved. One-time gene editing therapy has recently been approved in England for people with very severe forms of sickle cell disease. Gene editing therapy is also available in USA, European Union and Canada. Clinical trials show that gene therapy can produce functional cure in 96.6% of the patients with sickle cell disease. This is a groundbreaking success, and it can help thousands of people around the world who suffer from this condition. Please note that this is strictly for educational purposes and is not intended for a formal diagnosis or treatment in any way. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first.